If you have questions or problems with the port, the best person or people to ask is whoever the clinical team is that cares for your child. Also, you can talk to the visiting nurse if you have a visiting nurse coming out to your house. While you're inpatient or in the hospital, you can of course talk to either your physician or your nurse or your healthcare provider if you have any questions about the port. When you go home with a child with a Portacath, one of the most important things to watch out for is infection. Some signs of infection are redness or swelling around the Portacath, any discharge or drainage from either the port site or the surgical site, a fever above 100 degrees Fahrenheit. You want to make sure that you tell your physician or healthcare provider right away, because those are all signs of infection from the Portacath. One problem to watch out for is something called a fibrin sheath, which is a small piece of tissue that will form over the end of the Portacath, which makes it so that when you access the port, you can't draw back blood. This is not something that you'll know about if the child's port is unaccessed, but when it's accessed again by a healthcare provider or nurse, they may not be able to draw blood from the Portacath. And that's pretty easily remedied with a medicine that we can put in the Portacath to help it work again. Something else that can happen is a clot can form because of the port. This is pretty rare, and again, you won't know that it's there unless your nurse or healthcare provider tells you about it. Lastly, because of the way where the tube sits so close to the heart at the end of the Portacath, it can cause arrhythmias or irregular heartbeats. So if your child complains of a fast heartbeat, any trouble breathing, any fluttering in their chest, they should be evaluated right away.